Good afternoon, everyone. Good afternoon. Welcome to another Sunday chat with Dr. Madeline. Thank you for joining. As you come into the Facebook Live and into this Sunday chat, please wave or share your name with me in the chat box. I'd love to personally welcome you for joining today. Thank you so much. Today we're going to talk about what it means or what happens when a woman comes to her doctor and says, my ovaries hurt. Okay, that's actually something that we hear not too infrequently from patients. So I wanted to talk with you guys today about what that means. Hey, Natasha, thank you so much for joining. I appreciate you being here. Awesome. So I'm just going to give about one more minute and then we will go ahead and get started. Today we're going to be talking about what it means when someone says, my ovaries hurt. You know, I know that's a phrase, sometimes it's said jokingly in different circles, especially among women. So I'm excited today. We're going to talk about that. And also I want you guys, if you have any questions as I'm talking, please feel free to just, type them into the chat box. And I will make sure that by the end of the conversation today that I have a chance to answer those questions and let you know what's going on in terms of ovarian pain. Okay? Okay. All right. Okay. Well, let's go ahead and get started. It's about 2 minutes after 4. And like every week, I promise you guys that I'm going to try to take no more than 15 to 20 minutes of your time just for us to cover different topics. And so let me start by introducing myself. Hello, good afternoon. Welcome to today's Sunday chat. I am Dr. Madeline, your board-certified OBGYN, international speaker, and published author. By providing direct, specialized GYN care and direct access to birth control, I help busy women be able to access the GYN services that they need. I love trying to help make things more accessible for women, and ultimately that helps women with more control and more freedom of their lives. And so, welcome. If you are able to, please check me out on Instagram, Facebook, and Twitter. And my tag is Dr. Madeline MD. DrMadeline MD. Okay, so thanks again for being here today. If you join us, please feel free to say your name or wave in the chat box, and I'll welcome you here personally, okay? Thanks again. So today we're going to talk about what it means when someone says, my ovaries hurt. That's something that that happens not too uncommonly. I know that as an OBGYN who's been practicing for over 20 years, it's something that women will sometimes come in and say, or maybe even into the ER, either in the office or the ER. Again, welcome to all those who have joined. Please, if you're able to wave or put your name into the chat so I can welcome you. Thanks again for being here. And hey, Lee Number, thank you so much for being here. I appreciate y'all. Thank you, Natasha and Lee. Okay, so what does it mean when someone says my ovaries hurt? We're going to be talking about 3 things to consider when thinking about ovarian pain. So before we get started, you guys know that I'm very visual. I'm a visual learner. I know not everyone is, but I always want to make sure. Hey, Sean, thank you so much for being here. I appreciate you. Thank you. But I always like to start by making sure that we're all on the same page in terms of what we're talking about, okay? So I'm going to show you this this little graphic. And when someone says my ovaries hurt, what they're really saying is that here in the lower part of their abdomen or pelvis, where the ovaries are, they feel some discomfort. So ovarian pain, a lot of time when we hear that from patients, we'll think of lower abdominal pain, pelvic pain, because that region is usually what a woman is talking about when she says, okay, my ovaries hurt. And, that's something that we hear more commonly than you might think. Some women are very specific when they think about what's going on in their bodies. They think about the fact that their ovaries are in the lower part of their abdomen, and so they might go directly to calling it ovarian pain when they're trying to describe what's going on. And so I show you that schematic so that you guys know where the ovaries are. So the ovaries are important because they're a very important organ in women. They serve a lot of reproductive health functions. They release hormones that help women. They release estrogen and progesterone. You guys may or may not already know when a birth control pill is helping to prevent us from getting pregnant, it's stopping that estrogen and progesterone loop so that you don't ovulate. The other things that our ovaries do is that I mentioned a couple of weeks ago that when we're born, hey Lorraine, thank you so much for joining. I appreciate you being here. So I mentioned a few weeks ago that when we're born, when we women are born, we're born with all the eggs we're going to have in our lifetime, and about 1 million. Then when we get to puberty, it's about 250 to 300,000. And so the ovaries are the organs that hold all of those eggs in our bodies until we get to puberty, and then they start to release the egg when we have our menstrual cycle. And the other thing that is important about an ovary is that when a woman gets pregnant, the egg that is released comes from one or both of the ovaries, sometimes more than one at a time. That's how people end up with twins or triplets. And so it's fertilization from, the ovary releasing an egg that egg could be fertilized if the egg meets up with the sperm. Okay, so the ovary is a very important reproductive organ. And so we're going to talk about what it means, or what some of the things that we should be thinking about when someone says to you, okay, my ovaries hurt. Okay, so again, for those just joining, Lorraine, she knows this already, but just where we're talking about when a woman says my ovaries hurt, that lower abdominal pelvic area is what she's usually describing. So 3 things that we're going to talk about as it relates to someone feeling like they have ovarian pain. The first one we're going to talk about is something that's very normal that happens every month. It's called ovulation pain, or Mittelschmerz, and we'll talk about that. The second thing we're going to talk about is ovarian cysts. They can happen on one or both ovaries, and we're going to talk about how that might be moving away from being normal ovulation pain and what that might be a sign of. And the third thing we're going to talk about today, we're going to spend some time talking about ovarian cancer. This month, September, is Ovarian Cancer Awareness Month, and so there are some things I want to just put on you guys' radar to make you aware of, in case you ever have questions as it relates to this, things to think about when you reach out to your provider, your OBGYN or your other provider, to ask certain questions or to see what's going on. Okay, so my ovaries hurt. Let's start with ovulation pain. So that's the first thing I want to be on you guys' radar. So when a woman is reproductive age, and remember, reproductive age means from the very first time you have your cycle until the very last time you have your cycle, or menopause. So menarche is that first cycle, and menopause is when you reach your, usually the average age in this country is 51. So when you reach around, 51, if you still have your uterus and your ovaries, you would naturally go through menopause around that time. And so when you're reproductive age, a lot of times what's going on when you have your monthly cycle is there's an egg that has matured in one or both of your ovaries, and that egg is released. Now, if you have, if you're one of these lucky people who has a cycle that comes every 28 days, what will happen is that you will usually ovulate right in the middle of that cycle. So think of, when we say 28 days, I want you to think of day 1 as the first day of your cycle, okay? For most women, a cycle might last between 4 and 7 days. So, when you say day 4, you're talking about, for some women, what might be the end of their cycle or almost close to the end. So if the first day of your period is day 1, count to day 14. If you have some lower abdominal pain, hey, Cuz Barb, thanks for joining us today. I appreciate you being here. So if you have lower abdominal pain that happens right in the middle of your cycle every month, if you're reproductive age and you're still having cycles every month, then that is usually going to be ovulation pain, or Mittelschmerz. It can happen on one side 1 month, the other side the other month, and again, that ovulation pain is very normal. There are some women who don't have regular cycles every month. They might skip a month. It becomes more challenging for them to know whether or not that lower abdominal pain that they're having is related to ovulation. But I wanted to make sure you guys were aware of that, because a lot of times when women come to see me in the office, or sometimes in the ER, although the ER, they come in usually for more severe pain. But when women come in and, as we're talking and we're getting their full history and doing their exam, a lot of times something that will come out of it is that, okay, this may be regular ovulation pain, and there are some things that we can do to help you manage that pain, whether it's prescribing them some Motrin. Hey, Dr. Banga, thank you so much for joining. I appreciate y'all being here. We're talking today about what is going on when someone says my ovaries hurt, and we're talking about three things. So again, the first thing that we're talking about is just regular ovulation pain or Mittelschmerz, and what does that mean for women. So like I was saying, when we do the history and the physical, and from everything that we talk about, and based on the exam, if we determine that it's Mittelschmerz or ovulation pain, a lot of times that reproductive age woman can try Motrin to take it during that time of the month, and a lot of times that will help her pain. Another thing that's sometimes considered is birth control pills. Birth control pills, as I mentioned, help by suppressing ovulation. And so when the ovulation is suppressed, a lot of times those birth control pills will help that woman not be as uncomfortable when it's time for ovulation, okay? So so that's the first thing I want you guys to think about when someone says, or to you, or if you hear someone say, my ovary hurts, is it routine, or is it abdominal pain or ovulation pain that is within normal range for women who are in their reproductive years and still having regular cycles, okay? So the second thing I want us to talk about today is what else might be going on if someone says my ovaries hurt, and if in the course of doing a routine history and physical, if it seems like it's a little bit more than just regular ovulation. One of the things that we commonly will diagnose in GYN is something called ovarian cysts. Now, I want to make sure we cover this, because there's a range of things that we can mean when we say ovarian cysts. Ovarian cysts, we just finished talking about ovulation. So when a woman ovulates every month, we spoke about the fact that the egg is released and it goes into the fallopian tube, and if that egg meets up with sperm, then it could potentially be fertilized, and a baby can develop. But what happens at the ovary after that egg is released, it kind of seals over and it forms a cyst. So a cyst is a normal part of our monthly menstrual cycle after that egg is released. But sometimes those cysts can get a little bit large. Sometimes they don't just, and every month they would normally go away. Sometimes they don't go away on their own. And sometimes a woman can come in describing symptoms of having a cyst. Though those symptoms might be something more prolonged than just her regular ovulation pain. If pain is related to ovulation, it tends to get better or go away on its own within 24 hours. If a woman has a cyst on her ovary, it might be, hey, Janet, thanks so much for joining today. I appreciate y'all. If a woman has a cyst on her ovary that's more than just regular ovulation pain, that lower abdominal pain will go on for more than just 24 hours. She might feel pain for several days, maybe several weeks. She might have discomfort when she urinates. Hey, Michelle, thank you so much for being here. I appreciate you for joining. Thank you guys. As you come in, like and share if you think someone else might need this information. Today we're talking about my ovaries hurt, and what does that mean? So again, we finished talking about regular ovulation pain that happens in reproductive age women every month, and so we're talking now about ovarian cysts. So ovarian cysts can range in size. They can be on one ovary, they can be on both ovaries. Most commonly, you might have someone that has a cyst. When a cyst starts to bother a woman, it might be in the size of about 4 to 5 centimeters or larger. When it gets to 7 centimeters or larger, then sometimes there are different things that we have to do as caregivers to try to figure out what's going on, and whether or not a surgical intervention is required. Thank you, Janet. Okay, I'm gonna answer that question. Are cysts normal after menopause? So it depends actually. Our ovaries after menopause, technically they've shut down, right? So we shouldn't have any biological cysts forming because of the process of ovulation. However, that said, there can sometimes be accumulations of fluid that happen in cysts and ovaries after ovulation. Depends on whether or not the fallopian tubes are still there, depending on what else is going on in that woman's lower pelvic abdominal cavity. But in general, cysts should not develop newly on ovaries after menopause. Now, the third group I'm going to talk about today in terms of what's going on with my ovaries hurt is ovarian cancer. And so we'll talk a little bit more about some of the things that have to be considered if a cyst newly appears on a woman who's gone into menopause, okay? So, again, when we're talking about that second category, ovarian cysts, most ovarian cysts are benign. Most times it's just a cyst on the ovary that's filled with mostly clear fluid. When we do, sometimes as part of the workup for a woman who has lower abdominal pain or pelvic pain, we might do an ultrasound, and that ultrasound gives us more information about what might be going on. So if on that ultrasound we see a cyst on the ovary, we do a few things. We want to measure it. We want to see the size of it. I mentioned that, it could be as small as 2 centimeters, could be 5 centimeters, could be 10 centimeters. So there's a size at which we as OBGYNs become more concerned, and certain sizes might move us toward intervening sooner rather than later. We also look to see, is the fluid inside the cyst, is it clear, or does it have some things that look almost like particulate matter? Some things that might make us concerned that maybe it's not a simple fluid-filled cyst. Maybe there's some other stuff in there that we might need to take a closer look at. We look at whether or not there's any signs of inflammation. Sometimes you can have cysts on the ovaries, and after not having many ruptured ovarian cysts for about 10 years in my practice, I've had 2 in the last couple of months. And what happens is a cyst, there are normal blood vessels as part of the ovarian anatomy. And if a cyst is near a blood vessel and it ruptures, most times when we have a cyst that ruptures, it's small enough and it just heals over, and our body might feel a little bit of discomfort for a couple of days and then it's gone. But sometimes you can have cysts that rupture, and maybe they rupture right near a blood vessel, and that blood vessel bleeds to the point that a woman feels very, very sick. She has more severe abdominal pain. It's not just like a little cramps. She has severe abdominal pain. She might feel dizziness and some lightheadedness because she's bleeding into her belly, and so her blood pressure may be going down. So that is something that's more serious. A ruptured ovarian cyst is something we take very seriously, and a lot of times we have to do surgical intervention to stop the cyst from bleeding and also drain the blood that's accumulated in the belly. So someone who has more severe symptoms from an ovarian cyst or a ruptured ovarian cyst will have more abdominal bloating, more pain, sometimes a headache, fever. They can definitely have different things that happen. So that's the second category I want to talk with you guys about. Oh, now let me say this. If you do have a simple cyst that's only filled with clear fluid based on ultrasound and everything we can tell, a lot of times we can treat that with something that's not invasive. Sometimes I mentioned that we can prescribe birth control pills for people who might be having ovulation pain, just regular ovulation pain. But we can also prescribe birth control pills for someone who might have a cyst, a simple cyst that's only fluid filled, that's about 5 to 6 centimeters or smaller. We can prescribe birth control pills and see if that cyst shrinks or decreases after the woman has been on those birth control pills for a couple of months. Thanks, Janet. I'm glad that answer helped you. Thank you so much, Dee and Strouder, for joining today. I appreciate y'all being here. So let me just recap. We're talking about what it means when what it might mean when someone says my ovaries hurt. And we're talking about the fact that the ovaries are in the lower part of the abdomen and the pelvic region. And so the first thing that we talked about was Mittelschmerz. That's the fancy German word for just ovulation pain. And that's something that happens commonly when a woman is in her reproductive years. And that means she's still having her menstrual cycle. The second thing we talked about is ovarian cysts. Those can be within normal if they are right after that ovulation and the woman just has a cyst healing over, or it can be something more severe that we have to investigate more closely to see what's going on. The third thing we're going to talk about in terms of ovaries and my ovaries hurt and ovarian pain is ovarian cancer. Now, the majority of women who have what they describe as ovarian pain, the majority do not have ovarian cancer. Ovarian cancer happens in this country. About 22,000 women every year are diagnosed with ovarian cancer every year in this country. Now, that's not to say, I mean, you know, when you read different things, they'll describe it as rare, but 22,000, it's enough that, and certainly enough people's family members or loved ones are affected that I don't feel comfortable saying the word rare, because it definitely happens in enough people that we love and care about. So what does it mean when we have to start thinking about ovarian cancer when it comes to someone reporting ovarian pain or low abdominal pain? Ovarian cancer is interesting, and again, this is Ovarian Cancer Awareness Month. September is Ovarian Cancer Awareness Month, so again, this is one of the reasons I wanted to talk about this today. But the majority of ovarian cancer does not actually present with any symptom at all. Okay, a lot of times when women have ovarian cancer, one of the reasons it's discovered late in the process is because early on in ovarian cancer, a lot of women don't have any symptoms at all. By the time someone has symptoms, it may be in one of the later stages that will require, you know, absolutely surgery and a lot of times chemotherapy. Those symptoms could include low abdominal pain, or, you know, my abdomen, doc, is suddenly bloating, and, you know, I haven't been eating that much. I don't know what's going on, but I feel like my abdomen is larger or has more girth in it than it usually does. Sometimes women will complain of, you know, when they eat, they feel more full early compared to, you know, maybe they used to be able to sit down and eat, I don't know, a cup or two of mashed potatoes, and they suddenly start feeling full after a teaspoon or two of mashed potatoes. That's what we call early satiety, or satiety, and it means that they just feel fuller sooner in terms of compared to their baseline. So the things to know about ovarian cancer, the most important part of having a conversation about ovarian cancer with your provider is the history. Now, there's about 20-25% of ovarian cancer is related to genetics and what's going on in your family history. And so, you know, family history is something, depending on, you know, your culture and your family, some things aren't talked about. But I always encourage my patients that, you know, when you come in, if we're about to have that first conversation, gather as much information about your family history as you can, because it can make a difference in terms of how your provider decides to go forward, depending on different risk factors and all of that stuff. So if you have a first degree, or, you know, a family relative who's had either ovarian cancer, breast cancer, and some forms of colon cancer, that may put you in a slightly different risk category for developing ovarian cancer. So again, that's one reason why that family history is so important. If you know that a relative died of cancer, to the extent that it's comfortable, you know, when there's an opportunity, when things are not so hectic, see if there's a family member who might be able to give you more information. And as we all kind of process and deal with the recent loss of Chadwick Boseman from colon cancer, is one of the things. I know I had a patient come in, she saw some blood in her rectum, and she's maybe 32 years old, but it's a conversation that more and more people, I think, are having because of the reality and the devastation of losing someone so young to something like colon cancer. So again, when it comes to ovarian cancer, again, a lot of people don't have symptoms, but if they do, you know, there might be some bloating. There might be, let's say it's a postmenopausal woman. Ovarian cancer tends to show up more in women who are 50 or more, 50 or older. If someone has been through menopause and suddenly they start having bleeding after menopause, ovarian cancer might be something that we think about. Do they have bloating? What does their pelvic ultrasound look like? A lot of times we do ultrasounds depending on what's going on with someone's history to determine, okay, you know, what's going on with the ovaries. Do the ovaries look normal? When we do the exam, when we do the pelvic exam, we're feeling to try to know, does that ovary feel enlarged? Is there tenderness? Is there pain when I do that part of the exam? Those are things that we look for. Depending on what's going on with the ultrasound, a lot of times your provider will also get a CAT scan. A CAT scan helps us get a lot of information about what might be going on in the abdomen and the pelvis. Sometimes, especially if there's a family history, your provider, if they see something unusual in that ultrasound, looks like your ovaries have, you know, something enlarged there, or a mass or something like that, they might send a blood test called a CA-125. Now, a CA-125 is a tumor marker that basically, in some people with ovarian cancer, not everyone, but in some people with ovarian cancer, this tumor marker would be elevated. And so it helps as part of that diagnosis process to try to figure out what's going on. Anyone who has ovarian cancer that's diagnosed, they absolutely get referred to an a GYN oncologist, or someone who specializes in taking care of GYN cancers, because the goal of trying to do surgery on someone, if ovarian cancer is diagnosed, the goal would be to try to remove as much of the cancer as possible, and then start chemo or radiation, something that's going to give the body a chance to try to get rid of any remaining cells when it comes to ovarian cancer. So those are the three things I wanted to, I've gone over time. I know I usually promise you guys 15 to 20 minutes, but I really wanted to make sure that we spent some time talking about that phrase that we hear so commonly, my ovaries hurt. Could be routine, regular ovulation pain, or Mittelschmerz, that fancy German word. Could be cyst on the ovaries that could be benign, really small, like a centimeter or two. Or it could be a cyst that got larger and ruptured, causing a lot of pain and blood in the abdomen. That becomes a surgical emergency. Sometimes, not all the times, if it's actively bleeding and the patient is unstable, it does become a surgical emergency. Or is it ovarian cancer, which we diagnose less frequently than the first two that I mentioned, but certainly is something that should be on the radar, depending on the rest of the woman's history and her physical exam, and maybe that pelvic ultrasound. So those are the things I wanted to talk with you about today in terms of what it means when someone says my ovaries hurt. Now, there's one other time when someone might jokingly say my ovaries hurt. And I don't know if you have girlfriends or friends who might see a very cute baby or something going on, and they're like, oh, my ovaries hurt. And they say that to say that, you know, this baby is so cute that I think I just ovulated. And so, you know, that's another way you might hear that phrase used in a joking way. So let me go here. I have a couple of questions. Thank you so much, Deanne Strader. And Lorraine has a question. She says, what about uterine cancer or fibroids, doc? Is that person at an increased risk? Not necessarily, Lorraine. So the uterine cancer and fibroids can definitely happen in the uterus, and the ovaries are separate from that. Now, there are some situations in which ovarian cancer is thought to be tied to the fallopian tubes being in place. So there are some studies these days that are saying if you are doing surgery for someone and they might have an increased risk of ovarian cancer, or, you know, based on their history. Remember, everyone is so different. When you do their history and their physical exam and their family history, what is going on, would they benefit from having their fallopian tubes removed? And yes, there are studies saying that by removing the fallopian tubes, you decrease the chance of some types of ovarian cancer. So uterine cancer and fibroids, those are also GYN cancers. Fibroids tend to be mostly benign. It's less than 1% that would become a uterine sarcoma. So fibroids tend to be mostly benign, although they do cause a lot of issues in women. Women can have heavy bleeding, they can have a lot of pain. So, and fibroids are the #1 reason for hysterectomy in this country. So even though fibroids are usually not cancerous, usually they're benign, they contribute to so much sickness and just shift the quality of life for so many women in this country that many women will have a hysterectomy to deal with fibroids. Now, uterine cancer, you know, also endometrial cancer. I'm going to spend some time. I had some other people ask questions about uterine cancer, so I'm going to cover that in more depth next week. But certainly endometrial cancer is something to be mindful of. Hey, Alana, thank you so much for joining. And it's one of the things that might present similarly to ovarian cancer, because you might have someone with irregular bleeding, especially if they're 35 or older. We tend to do a sample of the endometrial lining to see whether or not it might be endometrial cancer. Endometrial cancer is also different in that most times it gives us signs and symptoms early on in the process. And so endometrial cancer, whether it's an irregular bleeding or maybe a little lower abdominal pain, a lot of times we'll diagnose endometrial or uterine cancer a lot earlier and be able to treat that in a different way that might that increases the survival for women who have uterine cancer. Hey, Cheryl, thank you so much for joining. Thank you. So, is that person, I'm sorry, the second part of her question is that person at an increased risk for ovarian cancer? Not necessarily. No, those, a lot of times, those don't necessarily go together. But again, what's the person's history? What else is going on with that person? So, thank y'all so much. I appreciate all the questions y'all have, and I appreciate y'all watching today. Again, so we've been talking about, just to summarize, we've been talking about three things that I want you to think about or consider when someone says to you, my ovaries hurt. What does that mean? The first thing to think about might be just regular ovulation pain or middle schmerz, which is a normal thing that happens in reproductive age women every month when they have their cycle and they release an egg and they ovulate. That might be what's going on. The second thing that we talked about were ovarian cysts. Those can be anything from a small benign cyst that's just a normal part also of our monthly process, or something that is less benign. It could be a larger cyst, a cyst that doesn't have just fluid in it, or a cyst that ruptures that becomes a surgical emergency. So those are things to think about in the second category. And the third thing to be aware of is ovarian cancers. Again, they are less frequent than the first two things that we talked about in terms of ovulation and ovarian cysts, but definitely things to be mindful of, especially as we spend this month honoring those who have been affected by ovarian cancer. The Ovarian Cancer Awareness Month is September. So if you see teal ribbons and everything during this month, that's what it's doing. It's honoring those who we've lost, but also those who are surviving with ovarian cancer and on that journey already. So I want to again thank you all so much. Thank you again, Lorraine, not only for being here, but I see you invited a couple of people. Hey, Debbie and Dan Strouder, thanks so much for being here. If you guys have other questions that you think of after this Facebook Live is over, please feel free to type them in the chat. I think I can continue to see questions during the day or during the week if you have other questions come up. And I'll be sure that I get you an answer and respond. So next week, Lorraine, we're going to be talking about uterine cancer or endometrial cancer and spending some more time on that topic. So again, I want to thank you all. Hi, Debbie. Thank you again so much for being here. So I want to thank you all again for being here. I'm just so appreciative of you taking this time to spend with me, Dr. Madeline, on Sunday Chat. So just to give you guys my outro again, I am Dr. Madeline, your board-certified OBGYN, international speaker, and published author. By helping women get direct access to specialized gynecology care and birth control, I help busy women have more control and freedom over their lives by getting the care that they need when they need it on their schedule. And I'm trying to make sure that all of our sisters have as much information as possible to take better care of themselves. So please check me out on Instagram, Facebook, and Twitter. My tag is Dr. Madeline MD. That's DrMadeline MD. Thank you so much, and I look forward to seeing y'all next Sunday at 4 p.m. Bye-bye now.